Okay, so blessed good afternoon to N22 class. So we will continue our discussion on the pathophysiology. However, we have already started the discussion on the diagnostic process with the complete blood count, and we have already passed through the discussion with urinalysis. So let's just have a recap. We have discussed already last time pertaining to the urinalysis, and urine analysis are basically diagnostic examination that is essential to assess specifically hydration status, uh, functions of the renal and the urinary tracts. It may identify also liver diseases. Initially, it can detect already a risk for diabetes mellitus and definitely for urinary tract infections. So these are the components of the urine analysis. The components of the urine analysis, in particular, uh, consider the assessment of the if there are deviations or findings in the blood, RBC. So this is an indication wherein there could be possible bleeding or possible presence of urinary stones. For bilirubin and urobilinogen, uh, actually, for urobilinogen, this is much common that are present in the urine, but the bilirubin is not supposedly expected in the result of the urine analysis, because if ever there are findings that there will be results of bilirubin in the urine, then this could be very alarming on the possibility of results of the early detection of problem with the liver. When it comes to the nitrites can be also an indication if there is a deviation or findings beyond the normal reference that there is urinary tract infection. Same also with the leukocytes or the WBC, which is also an indication of a possible concern with infection. Usually, these results may subject to further study if it indicated or if it will be subject for specific antibacterial management and by urine culture and sensitivity test. The presence of the protein, ketones, and glucose are basically for the reference, for the reference of the problems with the possible problems with the kidneys, and at the same time possible problems on the chances that the client could be high risk for diabetes mellitus. For the pH and the specific gravity, the pH could significantly identify the acidity and the alkalinity. Okay, so for the acidity, it may be significant that you need to take into consideration if the person is high risk of infection or or having a problem with inflammatory conditions affecting urinary tracts, the liver, and the renal as well. The specific gravity is related to the concentration of the urine to specifically identify hydration status. So we have discussed also specifically the different types of analysis. So in the 24-hour urine collection, it is basically important to consider po, this is just a review na lang po, no? This is basically 24-hour urine collection is collected obviously in 24 hours, and its purpose for analysis is to identify and to measure substances such as steroids, white cells, electrolytes, and determine urine osmolarity. So the urine osmolarity is the combination of the pH, the level of acidity or alkalinity of the urine, or specifically the concentration, the urine concentration, which is identified in the specific gravity. For the best sample or type of analysis that is significant for the pregnancy testing is the first morning specimen, which we identified that these are done after recumbent position. So the purpose of having the recumbent position is to consider po the function of the bladder and to facilitate effective emptying and excretion of the urine sample, what is significant. So first time in the morning. Next, the fasting specimen. The fasting specimen, usually these are analysis when the patient was instructed to have the fasting, and usually after, for example, the patient was subject for fasting and passes through urine or passed urine. So the second voided specimen will be the after the period of fasting will be the one collected. So make sure ha, kasi kung for example, after the fasting, the client void and you collect the urine, so it's not the sample that we need. It's supposedly from the first pass of the urine after the fasting. Then the second pass of the voided specimen will be the one that will use for fasting specimen. So next, the midstream urine. The purpose of the midstream urine, we have identified this is for purpose of bacterial culture. And usually yung first and last part of the urine stream is not the one. It's definitely not the one that will be collected because of possibility that the urine is contaminated. So from the term itself, midstream, the mid portion or the volume of specimen can be utilized. So we have also mentioned about the random specimen. In the random specimen, these are the usual tests for purposes of screening. And there are no preparations. Yan, there are no preparations that are needed. Unlike for the other one, first morning, the other one is for may need fasting. The other one is collection for 24 hours. For the random specimen, these are the urine analysis or the specimen sample that are collected in a specific time or as requested. So that may not need any preparation. For the catheter specimen of urine, the collection of the urine sample will come from the catheter. Again, as I emphasize, the urine collection may not come from the urine bag, because there could be a possibility that the urine that passes through the hospital urine tube are already contaminated. So the sampling technique or the technique that can be done here is it will put forceps on the catheter, so that whenever the client already have the distended bladder, then the specimen that will be collected coming from the catheter. Kasi usually and eventually we cannot collect specimens since the patient is on catheter. And these are situations wherein samples are collected if there are possible problems with bacterial. Okay, so we have already discussed this type of analysis. So another review, we have reviewed also and discussed the routine observation for urine color. So we have the dark urine, which is an indication for dehydration. If the urine is already almost transparent, almost clear, so it's not a good indication also, because that is overhydration naman. So yung concentration niya ay sobrang diluted. So next is for the strong yellow po ang color, brown or green or strong yellow ang color, this is a indication of presence of bilirubin. Okay, so that's why we have mentioned na pag bilirubin is not expected as a result of the urine analysis, and possibly this may indicate a problem with liver. Next, if the client is taking mitomycin, or very alarming din to pag green ang urine, it is brought about by either the mitomycin or antibiotic, or either an infection caused by the Pseudomonas. For bright red or red-brown, this is an indication of hematuria or blood in the urine. But most probably, we need to rule out problems or concerns if the person has menstruation. So there is also food that may be associated or that may influence the color. So yung beetroot, the beetroot may cause a pinkish shade, and the drug rifampicin may lead to the possible orange or red color of the urine. So we have already studied that in the pharmacology na in the pharmacotherapeutics, there are some drugs that may cause discoloration of the urine, because basically we expect that the function between the liver and the kidney is relevant or related to the excretion of the excess properties of the drug. Okay, next po, we have, okay, so when it comes to the clarity, we have mentioned in the clarity also that the cloudiness itself may give us the idea that there are some instances for the cloudiness that could be harmful, and some has a harmful indication. There are two sets. The one findings that is not harmful, it's because possibly there are presence of mucus, presence of sperm, presence of fluid from the prostate, and skin cells. Kasi remember, di ba, yung mga dead skin na nagpasses through the urethral canal and passes through the external urethra and may mixed with the urine, yun po yung tinatawag nating mga skin cells. And the other one that may have a negative implication significantly for the significantly for the urine that may have also cloudiness is the presence of pus. Kasi the presence of pus is an indication of possibility of presence of bacteria or the white blood cell. And if the urine is frothy, so what do you mean by frothy? Mabula. Frothy, it signifies protein. Okay? The more that the urine is frothy, the chances of either high sugar content ang either you drink or high sugar content yung may yeast din. Kasi 'di ba usually pag mga alcoholic drinks, specifically beer, ayan, basically nagko-cause yan ng proteurine. Another, yung mga high sugar beverages may cause also high sugar level, and because of the high sugar level, pati si protein nagpa-pass through the urine. Kaya very important then to hydrate yourselves rather, if you are drinking beverages that are high in the sugar. So, when it comes to the smell, we have mentioned during our discussion that if it is fishy smell, the fishy smell is an indication of infection. Ammoniacal yung amoy, yung odor. Then when it is acetone smell, it is a possible findings of diabetes. And the strong odor, there is also food that may lead to a strong odor, specifically asparagus. So I think we ended up on this discussion. So when it comes to the RBC, okay, when it comes to the RBC, we have considered po that the urine must definitely not detect any presence of RBC because seemingly usually nga pag mga RBC yan 0 to 1, pero hindi naman definitely 0, pero pagka mga for females usually yan pag mga 5 up, medyo very crucial na yan unless you are not ruling out that you have menstruation, ha. Pag ang urine, if the urine has an indication of tinge of blood, okay, it has tinge of blood, the term is used as macroscopic. But if the in your urine analysis result, it revealed higher level or elevation of the RBC, and you have not visibly identified it by your naked eye, and it just only revealed through the microscopic evaluation, that is what we call microscopic. So again, macroscopic if there is already a tinge of blood that are present in the urine. Then if it is related to the urine sample or results that cannot be detected to the naked eye and is only identified through microscopic evaluation, it's microscopic. Kaya microscopic evaluation, use of microscope. Next po, this is the one that I have mentioned na ang bilirubin or urobilinogen, urobilinogen or bilingen are usually expected for the urine samples when evaluated. Pero class whenever you may have urine analysis, dapat negative ang bilirubin. So as what I have mentioned po, ang purpose kasi pagka may bilirubin in the urine, this is an indicator na it caused the breakdown of the red blood cells, and seemingly it is not a good indication kasi it may reflect a problem with the liver. So sabi ko nga po, when it comes to the suggestion of the results of findings with bilirubin, it may suggest liver disease, or possibly may concern din kasi dyan that the processing of the bilirubin may not be effective or efficient when it comes to the gallbladder. So this is also an indication pag may findings ang bilirubin sa urine na gallbladder stone. So very significant, di ba? Kaya that's why for nurses, you need to take into consideration if the client has, and I knew it because I do not have any more gallbladder. When the pain complaint of the patient is on the right lower cranial and radiating at the back, okay, and the client is having vomiting, so excruciating yung pain talaga and not manageable. So and then you have seen a result of the bilirubin positive in the urine. So it is suggested that there could be a possibility of presence of gallbladder stone. Okay, so for any clarifications or for any questions, our chat box are open for questioning, or you may raise your hand and unmute. So next po, when it comes to the nitrites, we have mentioned po that the nitrites are indicators po natin for the urine for presence of bacteria. Usually, 50% of the urine samples are identified talaga with bacteria. Kasi it's either, ito po yan it's either the problem is that of contaminated yung urine, or talagang basically the urine has really the microscopic evaluation results of presence of bacteria. So in this situation po, the elevation in the nitrites is suggestive of urinary tract infection. So ano na yung basis natin for the urinalysis? Kung mataas ang WBC, the next thing that you need to check sa urinalysis is yung presence of nitrites. Pag may presence na yung nitrites, we need to be alarmed. Huwag niyong ipagwalang bahala. Kasi as an indication of bacteria, pwede yan mag-cause ng travel or mag-travel yung microorganism to the internal perfusion. So pwedeng mag-travel yan through the urinary tract. So it's either the bladder will be infected. After the bladder, the kidney will be infected and it will affect the perfusion. So pwede kasi mag-spread yan through the perfusion at mag-spread sa ibang part of the body. But primarily, since it's detected in the urine, so expect muna primarily that it will affect rather the urinary system, which is we have identified the ureter, the bladder, and the kidneys. So significant tayo ha. So pag RBC, that's an indication wherein there's a concern with the bleeding. So it's ang next po is we will consider it is microscopic or macroscopic. If it is an indication of the infection, you need to check po nitrites as well as WBC. There is elevation. Next po, as what we have mentioned po, na we have what we call leukocytes. Presence of WBC is an indication of urinary tract infection. However, there could be a possibility na yung cloudiness of the urine, as what we have mentioned in the clarity, could be one of the consideration if there is pus in the urine. And that is what we call pyuria. Hematuria is for the presence of blood in the urine. Pyuria is pus in the urine. So, if it is already identified that the cloudiness is caused by the pus, automatic yan, nurses automatic yan. You need to take into consideration na agad yung urine culture and sensitivity test to basically identify the antibiotic treatment. Somehow, there is some situation po na just like for inflammatory diseases of kidneys and tuberculosis, no bacterial cells are detected, but the patient is said to have what we call sterile pyuria. What do you mean by sterile pyuria? There is an infection, but it's not detected in the urine. So but it need to rule out to have series of urinalysis for tuberculosis and some inflammatory conditions of the kidney, simply because nga mas nare-reflect ng leukocytes po or WBC ang infection. Pero because of the what we call sterile pyuria, once a patient will be diagnosed with tuberculosis or any inflammation of the kidneys as well, there will be a follow-up urinalysis para to check kasi usually ang tuberculosis very active yung kanyang ang kanyang bacteria nagta-travel talaga siya, pwedeng sa spine, pwedeng sa bone. So there could be a possibility also that it's within the blood that travels throughout the body. So next po, ito po protein. So we have mentioned po that in the urinalysis the protein, the ketones, this the same protein and the ketones the protein and the ketones is an indication of the possibility that the client is having diabetes. Usually findings diyan pag positive. Okay? Pero you need to take into consideration, sabi ko nga sa inyo, it may be dietary yung concern natin pagka mataas or nag-cause ng positive. Pero that could be also that could be also one of the indicators na that you need to be alarmed. So the next thing to do if there are already findings sa protein at already findings with the glucose and ketones, ayun, i-rule out na yan for another test for the fasting blood sugar to detect problems with diabetes. Another, there could be also a possibility that the presence of protein for pregnant women naman, di ba? If you can remember the discussion that we had in the pharmacology, na when there is a problem with hypertension, but without proteinuria, that is gestational hypertension. Pero if it is hypertension with proteinuria, anong tawag doon? Pre-eclampsia. So obviously the problem with pre-eclampsia are more considered as a problem. Kasi alam nyo po, the proteinuria can be an indication po na yung mga protein molecules po ay hindi nagpa-pass through sa glomerular filtration barrier. Kasi supposedly, ang protein po hindi talaga magpa-pass yan. Ang indication po nito, ang scientific explanation po dyan, ay meron po tayong tinatawag na glomerular filtration barrier. Yung glomerular filtration barrier, sinasala niya yung protein. Pero pag nag-pass through yan sa glomerular filtration barrier, kasi yung size nitong yung size kasi ng protein molecules is expected not to pass through the filtration barrier. Pero kung too much yung level ng protein, definitely it can pass through this filtration barrier at nagli-lead na yan to proteinuria. And usually, as mentioned po, pag may presence of proteinuria, hypertension, for pregnant, it's already pre-eclampsia. Then, the other one is, that is also an indication of kidney problem and diabetes mellitus. Kaya, very important po ang indication ng proteinuria. For the ketones naman po, it's the same that this is already an identification of the same problem with proteinuria. For the glucose po, sir, ang presence of urine or protein in the urine is proteinuria. Presence of ketones in the urine is ketonuria. Ano naman po yung presence of glucose? By result of positive results in the urine, that is what we call glycosuria. Usually, you must take this into consideration. I know that you are having now your OB. Ang patient natin ay nagte-take ng corticosteroids. Okay? Lalo na kung for example ang pregnant po ay nagte-take ng corticosteroids. Dalawa lang po ang pwedeng concern diyan. It's either the person is having corticosteroid or during the pregnancy, pwedeng nagli-lead na yan into diabetes-induced hypertension. So I think there's someone who raised the hand. Do you have question, Ms. Sipin?
Din, question lang po. Ano po din yung mga pregnant na nagtitake po ng OG o ng mga OG, parang sa ano pa yung mga OG orange, ganun po. Nagka-affect din po ba yung sa urinalysis po nila? Pagka,
the
ano
OG is
po?
referring to oral glucose?
Yes po.
Yeah, yung oral glucose, yan. Kasi when the person or when the pregnant women was subject to for the oral glucose, that is to significantly identify glycosuria and proteinuria. Kasi for example, 'di ba, kung yung high level of the oral glucose na tinitake ng pasyente can be filtered by the glomerulofiltrate barrier. hindi mag-a-appear dapat ang protein at ang glucose sa urine. But with that test or with that intake of the pregnant person or the client, and it showed that from the result of the urinalysis lumabas yung results of the what we call presence of protein. Yun, ang ano naman natin doon kasi yung sa preeclampsia walang OG. Pero pag ang person or pregnant who will be taking the oral glucose, ang ano naman doon, ang purpose is to detect problem with diabetes naman. Pwedeng mag-cause ng diabetes mellitus-induced pregnancy. Did I answer it, Miss Ipin?
Yes po, kasi din na curious po kasi ako. Before nag-work po kasi ako sa laboratory. And asa may releasing ng mga results po. So na-question ko po yun sa mga kasama ko doon sa work na bakit kailangan mag-take ng OG, ng oral glucose yung mga pregnant. Tapos ngingitian lang po nila ako. So parang ako curious ako, bakit kaya? Tapos ang sabi po nila is, abangan daw pagka may pregnant na nagsukad doon sa CR kasi masyado daw pong matamis yung iniinom.
Okay. Kasi the oral glucose kasi is an indication to detect nga problems with diabetes-induced pregnancy. So, o pregnancy-induced diabetes. Kasi, baliktad pala, diabetes-induced pala. Diabetes-induced na nagkakaroon ng gestational diabetes. Kasi nga, that could be a preparation nga kung yung level of the glucose that will be taken by the patient may be managed by the system and may not appear in the urine. So that's the purpose. Thank you, Ms. Sipin. So usually in this concern nga, as what I have mentioned, it is not expected to have the results of positive glucose lalo na for pregnancy kasi nga for the proteinuria, ito po ang difference kung si proteinuria ang indication niya preeclampsia. Pag glycosuria naman, ito naman ang rule out naman nito, diabetes. Sir, paano kung pareho? Ayan, nako, kailangan we need to monitor the BP and the other one is we need to monitor the blood sugar kasi it may have an implication to the fetus and the newborn, di ba? So, yan po. When it comes to the alkalinity, to the alkalinity and acidity, the range po of normal reference talaga ng urinalysis when it comes to pH is 5 to 8. However, when there will be findings of urine na too much acidic, ayan pag too much acidic ang urine, there could be an indication of formation of kidney stones. Pag ang urine naman po ay too alkalinic, that is an indication of urinary tract infection. So ano na ngayon yung i-check natin ngayon? Pag ang urine ay acidic, ang next na i-check mo RBC. Because diba, that's an indication of the possible bleeding or presence of kidney stones. Ano pa yung i-check mo pagka may chances po of urinary stones? Pag may mga crystals na findings dun sa urinalysis, crystals, amorphous urates, yan. These are the indication na yung mga crystals na yun are the ones that have been formed because of too much acidity of the urine. Kasi pag once na stuck yan, pwedeng nagkukos na yan ng nagkukos na yan ng formation. 'Di ba yung prolonged storage niyan sa urinary cavity niyan, pwedeng mag-cause na yan ng pwedeng mag-cause na yan ng possible kahit maliliit na stone yan. And ang urethral pathway natin very small yan, micro yung pathway niyan. At pwedeng mag-cause na a single crystal there may cause a possible bleeding. So pagka urinary stones, you must check pH if it is acidic, RBC, third presence of crystals. Paano naman po pagka alkalinic? Pag alkalinic naman po ang urine, you need to check naman WBC at saka nitrites. Yang tatlo na yan ang i-check ninyo. Nitrites and WBC is an indication by which the client is having a problem with urinary tract infection. Kaya lalo na for pregnant mothers, we will not definitely ignore pregnant mothers who are having urinary tract infection kasi pwedeng pwedeng mag-lead yan sa sepsis because the infection can travel up to the perfusion and the circulation and may reach the newborn or may reach rather the fetus if it is still in the intrauterine. Ang usually niro-rule out sa mga bacteria, be aware tayo sa mga ganitong bacteria. Pagka nag-culture and sensitivity niyan, pag may Proteus mirabilis, Klebsiella or Pseudomonas, ito yung mga common types na identified pag alkalinic ang urine. Pero since this it will not be detected by the simple urine analysis, it could be identified to the culture and sensitivity test. So that's why there could be antibiotics that may be given to the client. So i-apply mo na ngayon yung natutunan mo sa pharmacology na yung FDA category, 'di ba? Kung natatandaan niyo pa yung drug category ng FDA, kung yan ay category A, category B, these antibiotics are given sa mga pregnant clients which may not or may have an effect to fetus or maternal and to the fetus. Okay? Next, how about for the pH pa rin? Okay, sa pH. Class, remember ha, ang titignan nyo po pagka ang pH ay acidic, ang isa pa sa titignan ninyo dahil nga ang consideration natin, 'di ba, ang consideration natin pag acidic, pag acidic, check mo yung other components, 'di ba? So sa acidic, i-check mo dahil nagko-cause siya ng urinary stones, ang i-check mo pa ay RBC or crystals. Other than that, check mo na ang protein. Kasi usually, pag ang urine ay acidic, the greater chances kasi because of high protein intake. So sa mga high protein intake po, lalo na yung mga situations po na wherein supposedly the protein molecules will not pass through the glomerulofiltrate barriers, at tapos ikaw pa ay mga nag-high protein. Kaya dapat although protein ay very important ito for the tissue repair, pero too much protein itself at kung ang protein nip po ay high level sa blood at magpa-pass through yan sa GFR barrier, GF barrier, ayan, magko-cause yan ng effect sa acidity of the urine. Tapos naman, for dietary, kung mataas naman ang intake mo ng ng dairy products at saka ng vegetables, it may possibly lead to alkalinic urine. So, yan po yung titignan ninyo kasi may mga situations like ang urine mo alkalinic, pero di ba this is an indication of urinary tract infection? Sir, ang urine ko po ay alkaline or alkalinic. Pero wala naman pong there are no findings with the there are no findings with the what do you call this? There are no findings with the pag dire-detect natin kasi ang alkalinic urinary tract infection There are no findings with WBC and nitrites. Ano po kaya yung cause? So babalik ka ngayon sa dietary na pwedeng nagko-cause ng alkalinity of urine. Kung yung food that intake mo ay mataas sa vegetables or dairy products yung na-take mo. So that corresponds to the explanation. Another po, urinary tract infection, as what I have mentioned, and medication can also result to alkalinic urine. Most of the medications, yan alkalinic. Kaya if the patient is taking drugs or any maintenance medications, lagi nyo itatanong pag nakakita nyo ng alkaline, are you receiving any medications or any maintenance po? Ayun, so possibly that appears as alkaline urine. Very powerful lang information kasi it will direct you to the best explanation that you may give to your patient, na yung mga questions mo ay related, ay based from the evidence-based reference. Next po, yan, specific gravity naman. Sa specific gravity naman, ang normal range po ay 1.001 to 1.035. Ngayon, sabi ko po sa inyo, pag ang urine ay concentrated or too concentrated urine, that is an indication of dehydration. And if the urine is if the urine po is diluted, well hydrated yung person, pero you may come to think of it na pwede kasi po siyang ang problem po natin ay indication po siya ng overhydration. So ano rin tayo, ang problem naman pag overhydration, there could be possibilities naman na syempre expect mo pag overhydrated ka, iihi ka ng iihi. So there could be a possibility na merong mga electrolytes na may pass through the urine at pwede ka ring mag-lead into dehydration. Sir, di ba sabi niyo po, pag dehydrated, kailangan uminom ka ng uminom. Pero eventually, you need to take into consideration that there's only certain amount of limitations at a time. Hindi mo naman pag sinabing in a day, 8 glasses of water, at at one time, you will drink 8 glasses of water. Hindi naman siguro. Siyempre, madidistend naman yung stomach mo then before it reaches the kidneys. So, I'll just entertain the question. Sir, ask ko lang po if alkaline ng urine during high intake of vegetable, does it mean po ba na mga vegetarian person ay prone to UTI? Eto po, hindi naman po kasi ang sabi ko nga po sa inyo, kasi kung for example, yung high intake of food, yan, intake of food, kung walang findings, if there are no findings, 'di ba? If there are no findings with the WBC and nitrites, nagiging alkalinic ang urine because of the intake of vegetables and dairy products. Pero the next thing to do is kung halimbawa naman nakita mo alkalinic, ano na yung titignan mo? Kasi nga pag alkaline, subject for an indication of UTI, ano na yung titignan mo? WBC and nitrites. Kung wala naman yan, results sa WBC and nitrites, the next thing that you will do so normal pala din. So the next question that you will ask is kung ikaw uh, ay high ang ingredients ng vegetables at dairy products sa diet mo. So yung mga vegetarian, expect mo pwedeng wala silang UTI pero yung the nature of the urine which is alkalinic is brought about by the increased vegetable intake kung sa mga vegetarian. So I hope I have answered the question po. Next po. Next po. Ayan, I have already mentioned this. Pero very important, sabi mo nga sir, yung specific gravity, pag diluted yung urine at concentrated. So we all know but na pag concentrated ang urine, it's an indication of dehydration. Pero pag diluted ang urine, eto na po, high fluid intake. So meron tayong preferred volume lang in a day. That's why nga sinabi nga, it's almost 8 and 250 per glass. So pag too much naman yan, syempre too much din yung i-excrete na urine. May mga indications naman din na class ang diluted urine tapos mataas yung amount. Kasi 'di ba sabi ko sa inyo class, 1 kilogram of body weight ay equivalent to volume of urine per hour. So kung ikaw ay 50 kilograms ka, expect mo na kung iihi ka every hour for example lang kung iihi ka pero it's impossible kasi that's is not definitely the bladder capacity. So kung iihi ka per hour, expect mo 50 ml ang iihi mo. But there's certain volume that it will urge the nerves of the bladder for you to be aware that you need to void. Pero ang problem natin sir is paano naman kung at a time madalas pero more than 50 yung naiihi mo. For example, in 1 hour supposedly umiihi ka every hour tapos ang amount niya is 100 ml. So kung 100 ml yan, almost half of the glass na yan. 100 ml, 100 ml, 100 ml. Ang next na ipapa-evaluate po sa inyo if possibly you may have problems with diabetes insipidus. Kasi class, lalo na kung for example if the patient is in the ICU at mas you can monitor their urine output. If kung for example ang client mo naman hindi nagda-diuretics kasi 'di ba we all know that diuretics can facilitate yung excretion of excess fluid sa body. Pero kung hindi naman hindi naman diuretics yung client mo pero ang urine mo ang urine output ng pasyente is 300 ml in just 1 hour, you must be alarmed. Kasi pwedeng affected po niyan ang anterior pituitary gland na kung saan ito po ay nagre-regulate ng tinatawag nating anti-diuretic hormone. So ang ibig sabihin ng anti-hold, diuretic, ihe, hormone itself. So pag na-stimulate ang anti-diuretic hormone, it controls yung excretion of the urine or pag excrete ng urine. Pero pag parang na-deviate or na-alter yung anti-diuretic hormones, walang control. So, pag walang control, ihi ka ng ihi tuloy. So, too much yung volume as expected per hour, it could rule out diabetes insipidus. Okay, think of that Hindi lahat ng too much ang volume na iniihi every hour is good. It may rule out problem with diabetes insipidus. So kung ang hormone po na problema sa diabetes mellitus ay insulin, ang hormone naman po that is a problem with diabetes insipidus ay anti-diuretic hormone. At pag may alteration sa anti-diuretic hormone, excretion of urine is continuous and in large volume. So think of it. It may not be helpful. Next po, if the patient also is having high level of calcium. So, alam nyo po, ang mga elders, we advise them to have the calcium, di ba? Because of the chances na po na ang mga bones nila cannot store any more calcium. Pero the problem is that of kung too much naman, kunyari the client or the elder had taken too much calcium supplement, ano naman yon, ang problem nila man doon is since ang elders cannot regulate efficiently yung metabolic process, so pwedeng mag-increase immediately ang calcium level. So may certain amount din po, kaya yung you will notice yung mga Ensure, yung Enerbon Prime, these are mga milk products na ang ingredients niya ay different from adults and children. Kasi basically it is fit, definitely the ingredients and the nutritional content is definitely will fit to the physiologic response ng elders. Pero pag nag-lead yan sa hypercalcemia, ayan, expect po na ang urine ay diluted. Kung may mga endocrine disorders, kidney diseases, tapos yun nga, failure to produce antidiuretic hormone kasi ang antidiuretic ay nagko-control ng ihi, but somehow if the urine is uncontrollable, then check na yan. It must be checked na yan for the functions of the endocrine, specifically antidiuretic hormone. Okay? So before we proceed with serum enzymes, isoenzymes, and markers, do you have any question? Any questions? So please type 1 if you don't have any questions or for into clarifications. Type 1 in the chat box. Okay, so if you don't have any clarifications before I proceed with the discussion of serum enzyme. Okay, so I'm seeing 1, 1, 1, 1. Type 2 if you have questions. So nothing. So I have seen 1, okay, in the chat box. So meaning you understand po our discussion on the analysis. So thank you so much, and I really appreciate. But I will definitely have high appreciation if you will ask questions po. So for the others po, probably you are missing our self-assessment exercise. But anyway, let us now proceed to the next. Ito naman po, these are diagnostic examinations po that will be helpful sa atin whenever you will you will test specific damage po sa specific organs or parts of the body. So when it comes to the perspective of the elevation of these enzymes or isomarkers, actually what is the indication of the blood enzymes, isoenzymes, and markers? Kasi pag sinabi nating markers, it is basically an indication po na for a while. It is an indication po that will guide us kung ano pa yung further evaluation that we may have for the for a while. Okay. So basically what specific part of the body will have the further test. Pero as for the nurses, when it comes to these results, it will greatly give us the specific results na seemingly may lead to the perspective of appropriate and immediate interventions. So dito po sa sa alanine aminotransferase or SGPT. Ang ALT or alanine aminotransferase, formerly SGPT, this is used usually as a test to check po liver function. Okay? Usually yan pag mga liver damage, ano bang usual cause ng liver damage? Kasi usually yan smoking, alcohol drinking, or viral infections such as hepatitis. So pag mga drug intoxication, usually yan for liver din po, liver function. Ano pa, pagka may jaundice, obviously, pag mga hyperbilirubinemia, SGPT, SGOT. Lagi yan magka-partner. So ngayon, ang tawag na talaga kasi sa SGPT and SGOT is alanine aminotransferase, and the other one is alkaline phosphatase. So ano pa, what are the other interpretation that we may have for elevation when it comes to damage liver? So Other than the liver, ang SGPT or alanine aminotransferase also, if it is elevated, is an indication of damage to heart, to muscle, pancreas, kidneys. Ayan ha. If you are suspecting of any of damages of these organs, this is the test that will be used. For example, suspecting the client has a kidney failure, suspecting the client may have pancreatitis, suspecting a damage with a muscle, so problem with the heart. So SGPT could be the one that can be used as a reference as an indication of damage. Another po, so if we want naman to detect yung metastatic prostatic cancer, meron tayong tinatawag na prostatic acid phosphatase. Ang tinatawag nating prostatic acid phosphatase po, usually this is elevated sa mga prostate cancer at class if if the prostate cancer is already having a problem, yan, already having a problem when it comes to metastasis. Pag sinabi nating metastasis, if the what do you call this? If the cancer cells of the prostate already spread throughout the adjacent organs, so probably ang i-check po natin kung talagang on the condition of spread na dyan sa adjacent organs ay yung tinatawag natin prostatic acid phosphatase. So go back naman again to SGOT. Ayan, ang SGOT naman po ang dating name or former name of the test, but now it is already alkaline phosphatase. So ang alkaline phosphatase po or AST, formerly SGOT, this is again for liver. So dalawa na tayo for liver ha, for liver. And the other one naman po, ang SGOT is used for bone disease. Ayan, so kung may bone disease po, SGOT is the one that is used for testing. Pag elevated yan, dalawa na lang yung iisipin ninyo. Is it a problem with the bone or a problem with the liver? Kaya sometimes when it is checked pagka-liver to check SGPT and SGOT, it is go to verify po pag may elevation sa SGPT at elevation sa SGOT, confirmed liver ang problem. Pero if the results of the SGPT and SGOT, ang elevated lang po yung SGOT at wala namang significant findings with SGPT, that is suspecting for a problem with bone disease. Okay? So very important yan ha. Next po, we have the creatine kinase. Okay, for creatine kinase naman po, CK yan, CK. Or sometimes it is called as creatine phosphokinase. Okay, yung CPK or CK. Usually, ito po ang tinetest. For example, the client is experiencing chest pain. Class expect, this will be the test, CK or CPK. This is to rule out kung ang early chest pain na the patient is experiencing ay problem with oxygenation or either a problem na yan with the muscle tissue or depth of muscle tissue. Kaya the common test naman po to detect kung talagang ito ay heart attack na. Heart attack is the medical term for heart attack is myocardial infarction. Kaya MI. Okay, pag may MI na po yan, sir, ang next na i-consider yung test ay yung CKMB. Okay, CKMB2. So ito talagang magde-detect kung meron ng problem with heart attack. Kasi magkaiba si heart attack. Pag ang chest pain ay, for example, na-manage pa siya hindi siya na-manage ng drugs for 15 minutes. Pag exceed sa 15 minutes ang chest pain, pwede na yan papuntang heart attack. Okay? So do not ignore any chest pain ha. It should have been managed pa lang 5 minutes. So pag nag-exceed na yun sa 15 minutes and the client is already taking the drugs, oops, medyo isip tayo ng ways to determine. So pag ang patient po ay nagche-chest pain, the patient may have initially creatine kinase. Pero if you are suspecting na, para malaman mo na kung halimbawa ang test ang ano na po is heart attack na siya, hindi lang siya insufficiency of oxygen sa chest pain, CKMB na po ang i-check para yung extent po ng problem na ay heart attack at death na yan ng myocardial tissues. So from this perspective, kung heart ang problem, ano yung mga i-check natin? Tatlo. Kung heart ang problem, ang pwede natin mai-consider po ay alanine aminotransferase, creatine kinase, CKMB. How about in this enumeration of test, bone? So kung bone naman siya, ang itetest lang po natin ay ang alkaline phosphatase or SGOT. If the patient has a problem with the liver, so dalawa, it's alanine aminotransferase or alkaline phosphatase. Sir, paano po pag pancreas? O isa lang naman yung nakikita ninyo. So pag pancreas, the test is alanine aminotransferase or SGPT. Now, sir, paano naman po ang problem ay skeletal? So sa skeletal po, it could be used yung creatine kinase. Okay? Pwede rin po yung SGPT because it concerns with the muscle. So in this idea, nurses can be knowledgeable on what could be the one that will be considered specifically in the care management plan. Okay? Next po, how about if the consideration is yung liver, ang cause ng problem niya ay due to alcohol? Ayan, so check natin ha. Kung due to alcohol naman ang problem, usually ito yung mga nagkakaroon ng mga alcohol intoxication. Usually ito yung if you've known individuals who are taking alcohol tapos experiencing difficulty of breathing, nagpo-cause na ng redness talaga because that's an indication na nagpo-constrict na ang blood vessels. Ayan, ang ipapa-check po ay gamma glutamyl transferase or GGT. Okay? So, kung sir, is it possible din po ba na ipatest pa rin po yung alanine aminotransferase tsaka yung SGPT or SGOT? Yes po. Kasi that can determine pa rin damage with the liver eh. Pero dito kasi, ang liver damage is due to alcohol specifically for the GGT or gamma glutamyl transferase. Pero you can have also or you can use also yung other test din ng SGT, SGPT. Pero kung it is caused by alcohol, ito yung magde-determine talaga if the problem is due to alcohol. So another is, we have the lactate dehydrogenase or LDH. LDH naman po, again for the liver. So ilan na ba yung sa liver natin? Sa liver natin, 4 na yung nade-detect nating test na pwedeng i-identify. It's either the SGPT, the SGOT, we may have the GGT if it's caused by alcohol, and we have the LDH. So for the lactate dehydrogenase, it can also identify problems with the heart. Okay, so heart. So ilan na yung sa heart natin? Yung sa heart natin, we have already identified yung problem with SGPT, creatine kinase, creatine CKMB, tapos lactate dehydrogenase. So, class for nurses, para alam ninyo na pagka suspecting for damage of these specific organs, alam nyo na in mind ang pwedeng i-evaluate for diagnostic exam. So, other than, we could have also detect a problem with the kidney. So kanina, we have mentioned din yung kidney, di ba? So dalawa na yung sa kidneys natin. So sa kidneys, pwedeng lactate dehydrogenase, and at the same time, we could consider po the alanine aminotransferase or SGPT. So another naman for lung damage, if you will notice among the isoenzymes that we have enumerated, ang particular lang po sa lung damage ay lactate dehydrogenase. So yan din po ang makakapag-detect ng problem. So kung elevated siya. Next naman po, if the concern naman ay for cancer. Kasi kanina yung spread pag prostatic cancer naman po ay yung PAP, yung prostatic acid phosphatase. Ito naman po pagka to detect naman po ay chance po na ang liver po ay may liver tumors at ovarian tumors po. Ang ito po ay ang marker pagka AFP or alpha fetoprotein kung suspecting po of possible malignancy or benign at may tumor. So suspecting, for example, the patient had undergone the ultrasound tapos suspecting for a mass, so tumor, so that the patient will be subject for AFP or alpha fetoprotein, yung ovarian tumors and liver tumors. So kung ang problem naman ay colon, intestinal, for intestinal tumors or colon, carcinoembryonic antigen or CEA. So sa mga colon CAs po or cancers, ito po ang marker natin, CEA. Ano naman po itong prostate-specific antigen? Oh sir, what's the difference between the prostate-specific antigen from the prostatic acid phosphatase? Pag prostatic acid phosphatase po, we are considering na yung metastasis or spread. Now, if we are considering po na for example, prostatic cancer, naka-recover, cleared from cancer na po, pero suspecting again na umulit, 'di ba sometimes we could say na or it's he is already cancer free. Pero again after few months meron na namang signs na similar for the prostate cancer, ayun po, to check for nagkaroon ng recurrence or umulit, ang ipapa-check na po is prostate specific antigen. So I hope this will be very helpful yung serum enzymes, isoenzymes and markers. Para at your level, pag kayo po ay actual na nagsasuggest sa family members po and identified po yung specific organs na posibleng may problem, ma or pa or brother, sister, anyone relative in the family, any of the relative in the family, pa-test mo na yung pa-test mo na kung suspecting ka masakit kasi basically ang iko-complain nila yung pain eh. So dapat basic knowledge mo sa anatomy. So you will think kung for example, suspecting na yung location ng pain ay sa malapit sa liver by anatomical parameters yan. So para for to be sure, yung i-check na yung test that will subject the client to have results for liver. Pero still with the doctors pa rin yan, with the doctors advice. So I know that for COVID-19, okay, familiar na tayo dito pero sometimes you got confused you get confused when it comes to this indication. Ano bang pinagkaiba? Usually ang pinaka gold standard talaga in the detection of the COVID-19 infection ay ang reverse transcription polymerase chain reaction. So yung tinatawag nating RT-PCR. Yan, RT-PCR. So yung RT-PCR po ang gold standard to detect po talaga a problem with COVID-19. However, meron tayong mga rapid testing test. Okay? Ang rapid antibody test ay ito po yung pwedeng mag-result din, same as what the rapid antigen test, na pwede kasing mag-result specifically sa false negative and false positive. Bakit siya magde-detect ng false positive results? Kasi nga, ang rapid antibody test ay pwedeng mag-detect yan ng past infection lang. Pero yung active infection mo ay rapid antigen test. Kaya if you will notice, other than RT-PCR, ang antigen test na po ang kino-consider kasi that will detect the present infection level kung if you have COVID-19. Yung rapid genetic testing naman po ay significant po ito for the identification of variants na affected sa spread of infection. 'Di ba if you notice, if you have heard before na meron pa tayong Delta variant, tapos we have identified individuals na test for Omicron variant, ang next na chinecheck daan ay yung rapid genetic testing. Yung rapid genetic testing, pag nag-contact trace po, yung mga persons na nakasalamuha niya or in close contact ay ipapacheck kung rapid genetic testing if may mga symptoms among those close contacts at i-check kung Omicron variant na yon, it's through the rapid genetic testing. So this is an indication for screening and confirmation. So I think I ended up with those concepts of diagnostic process. So probably you deserve to hydrate because information overload even with the recall of the concepts. So instead of 6 o'clock, probably we'll have the early 15-minute health break for you to be hydrated and for you to stretch your extremities. So it's 5:40. Be back after 15 minutes as we continue our discussion with the pathophysiology framework on risk factors. Thank you very much. Okay, so let's have the resumption of our synchronous session with our new topic. So we are on the pathophysiology framework. So let's start with the discussion of risk factors. If we say risk factors, these are these are considered as, according to the World Health Organization, attribute, characteristics, or exposure. If we will try to consider our present situation with COVID-19 infection, risk factors are already identified. Kasi usually, with the basic knowledge in the chain of infection and the periods of disease, you're aware when is the time that an individual is already at high risk. Just like, for example, that on the stage of infectious agent, and on the time that the person is already a carrier, an exposure to a person who is a reservoir and considered as a carrier may 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 have the possibility that once it leaded to the third phase, which is the portal of exit, may significantly have the connection when it comes to how a person will have a new host, particularly with the identified infection of the causative agent. So if we say the risk factors, these are factors that could be the cause of a certain disease, attributable. If we say attributable, this could be a situation or a demographic uh, data or profile that can be useful, that a person could be high risk of a specific disease or disorder based from evidence-based findings, researches, or scientific explanation. An exposure could be also a risk factor. For example, exposure to infectious agents, exposure to hazards of environment, and exposure to individuals who are already considered as reservoir or carriers. This could be the chances of yung if the person could be prone to have likelihood developing a disease or an injury. This is according to the World Health Organization 2017. Now, there are various risk factors that we can be aware. Non-modifiable, modifiable, we have the lifestyle, and we can associate it with the social factors. Uh, when it comes to the perspective that we considered non-modifiable risk factors, for non-modifiable, the term itself non-modifiable, um, meaning this will consider po factors that cannot be changed. Just like for age is increasing. Once you have the increasing age, expect also the physiologic function and processes that may happen upon reaching a specific age. That's why in the growth and development, we have been oriented on what are the expected physiologic processes and functions that may happen from the newborn, the infant, the toddler, the school age children, up to the teenagers or the early adulthood, up to the late adulthood. So this will give us a picture that you could be also high risk because of certain situations, like on a level of hormones, children, adults may have sufficient level of hormones that is very important for the metabolic processes of the cells, which is the basic unit of the body. While for the elders, the possibility is that of the the sustainability and the reserve of energy and nutrients the cell is not anymore effective, simply because the hormones are not active, which is what I have mentioned, very important for the metabolic response of the cells. Just like for the gender po could be male or female. Most po, for example, for cardiovascular disease, male are more risk to early cardiovascular disorders compared to female, because uh, most of the males, when it comes to andropause at saka menopause, ang males po kasi may significantly consider na early po nagko-cause ang thickening of valves of the heart, compared to women who may reach the age of menopausal. So with that scientific explanation, since the males have the earlier stage or age that may determine the thickening of the valves, they are more risk of hypertension or valvular diseases at the early age, compared to women who may have the changes in the valves on the succeeding age compared to men. Later on, we'll discuss about predisposing factors. Predisposing factors that could be non-modifiable and some could be modifiable. Familial history. Familial history, we have genetic disorders or diseases and disorders that can be inherited by generation. So that's why it's non-modifiable, because it runs through the DNA of the generation. As we trace the the history from maternal to the paternal. Ethnicity. If you will check sa mga literatures pertaining to the individuals who could be risk of certain diseases, most that had been identified are African Asian. African Asian in such a way that it is based from the literature that the perspective of the African Asian are known to have increased uh, percentage of having cardiovascular disorders. So in this perspective, this may specifically identify what are the diseases or disorders that can be acquired by genetics. So that's why it's non-modifiable. So as mentioned, it is connected with genetic evidences. That's why we already have the list of those that can be inherited: diabetes, cardiovascular disorders, and many more. Even 'di ba, mga mental deviations, it could be definitely transferred to other generations as well. Previous history of a disease. For example, kasi usually pag ito po ay chronic illnesses na. Ano yung mga chronic illnesses? Chronic illnesses kasi they are already managed na at the time that they were diagnosed, and they have to they can maintain only the equilibrium of their health through a therapy, through specific treatment, or pharmacological management. However, for example, previous history of cardiovascular disorder, before nag-cause na nag-ano na siya, may history na siya ng heart attack. Heart attack is termed, as mentioned ko nga po sa inyo, as myocardial infarction. So if tissues of the heart already have tissue death, the second heart attack will be an aggravation, because the first heart, ibig sabihin, pag nag-second heart attack siya, nag-extend yung damage sa muscle tissues, and it's a worsening condition. For example, in diabetes naman, when the time that the person was identified with diabetes, then eventually nag-lead into a complication of one organ, so posible siya as non-modifiable risk factors. So those that are pre-existing illnesses o comorbidity are considered na as non-modifiable risk factors. So these are the non-modifiable: the age, the gender, the family history, ethnicity, genetic evidence, and previous history of illnesses. Let us now proceed what modifiable risk factors is. The modifiable risk factors naman ay focus significantly on the what? Are focused more on those that can be controlled. Measures seemingly that there are interventions to control. Unlike for non-modifiable, it cannot be controlled. It runs through the ano na yan eh. The ethnicity, genetics, previous history, and family history. But for the modifiable risk factors, these are the factors that identified, okay, that had been identified on the time of assessment, on the time of the person had been subject for the results of diagnostic exams. So for example, sir, the patient had vital signs. And if the patient has vital signs and revealed hypertension, the next thing to do is, do the patient has history of hypertension, family history, history muna, past medical history. Do you have history of hypertension? Oops, pasok sa non-modifiable yon kasi previous history. Do the family have history of hypertension, maternal and paternal? O paternal, oops, pasok sa non-modifiable risk factors when it comes to family history. Next, from the age, ang age ng patient po natin ay 65 years old. O based from the literatures, most of the age 65 years old are the ones prone with hypertension. So pasok sa non-modifiable. Gender, male, because of the explanation that the bulbs thickened at the start of the age of 60 to 65 years old. So ang dami, dun sa, based from the data that you may have, you can easily identify non-modifiable risk factors, and this could be used as your reference. Ngayon, if the patient has hypertension, pasok na siya sa modifiable risk factors kasi modifiable kasi it's not one time that you will check yung blood pressure niya. Any deviations for that you may have for vital signs, blood pressure, heart rate, respiratory rate, oxygen saturation, it may vary through time, di ba? Pero once you have findings na deviated na from normal reference, this could be modifiable risk factors already. So just the same as for the cholesterol level. Ang cholesterol level, magba-vary yan depending on the response ng body natin sa synthesis ng cholesterol. So, if ever the patient had diagnostic results of elevated LDL or HDL, high density lipoprotein, low density lipoprotein. So the bad cholesterol is the low density lipoprotein. Kung mataas ang cholesterol, a patient could be high risk or may have modifiable risk factors na pwedeng mag-cause ang fatty plaques or yung cholesterol itself. Mag-thrombi siya. Thrombi meaning mag-dislodge siya sa blood vessels. This could be reasons of obstruction, and it may cause a delay in the blood supply to the heart, specifically in coronary circulation. So mag-chest pain ng pasyente. So it just initially identified po based from cholesterol level. So smoking, sir, as what we have noticed from your projected slide, modifiable po ang smoking at the same time lifestyle. Yes. Kasi there are some lifestyle, most of the lifestyle actually are identified din natin sa modifiable kasi this could be controlled. So just like for the instance na ang smoking ay modifiable kasi it could be it could be controlled. Example, a person may have 1 stick in a day, the other person may have 1 pack in a day. So that's basically different. It can be controlled by the person. It is depending on the preference of the person when it comes to the intake of cigarettes. Next, weight. Weight varies, okay? Depending on the response, nutritional response, metabolic response, history. So, sir, ang obesity po ba ay non-modifiable, modifiable? Obviously, ang weight is not constant. So, modifiable risk factors po siya. That's why for the body mass index, weight could be undernourished ang patient or the patient has obesity. Next, modifiable markers for chronic inflammation. So yung mga markers, kanina we have discussed about isoenzymes, we have discussed about we have discussed also markers, so indicators. So yung mga results na yon na mga markers natin could be used as modifiable risk factors. So itong sinabi natin na markers of chronic inflammation, for example, basically incomplete blood count, we have WBC and results of differential count that could be used also. Any deviation on the results of diagnostic evaluation can be considered as modifiable risk factors. So when it comes to the lifestyle, sa lifestyle naman, if you can see, smoking is still there because it's part of the everyday living, yung control. Diet could be considered as lifestyle po because the pattern, the dietary content may vary each day. So lifestyle siya. Exercise, person can be engaged to physical exercise or not. Stress, we have level of stress that the person, different level of stress that the person may have. It could be a mild, it could be the person can cope easily, or the person may lead from stress to anxiety. So sa social factors naman, these are the factors na indirect doon sa non-modifiable and modifiable pero contributing. Example, income. So yung income ba na and unemployment, for example, can contribute to the present situation of the patient with hypertension? Possible kasi for example, yung income may not support medical consultation. Income may not support maintenance drugs. Income may not support hospitalization. So these are the factors that may consider. Social deprivation could be kasi kung for example if there are mental deviations tulad ng mga protocols that are implemented, physical distancing, so no interactions muna. So pwede yon, social deprivation. Environmental, this could be considered po as predisposing din na wherein it could be, for example, yung residential close to a factory that caters mga harmful substances, sa work environment, noise pollution that may cause also stress. So these are the risk factors. I know and I hope that you do understand the difference between non-modifiable and modifiable. So to go deeper when it comes to the modifiable risk factors, these are the behaviors, exposure that may raise or lower the person's health risk that can be changed. Okay? Kaya can be modified. So sir, naka-indicate dyan yung abdominal obesity kasi abdominal circumference can vary depending on the 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 body response when it comes to metabolism. So sabi ko nga sa inyo, anything that may not be normal, kaya nga tayo merong body mass index, we have the appropriate weight for the specific height, di ba? And if it goes beyond the BMI, so possibly that's obesity. So high blood pressure, so we have identified any deviation with the vital signs. Diabetes could be, but this is more referring to the blood sugar level that may vary, pero pag nag-elevate na yan, considered na yan as modifiable risk factors. High cholesterol, so we have identified that this considered as modifiable. Psychosocial factors, so meaning if the person prepared not to engage with other people at nag-compromise yung kanyang mental health, yan, modifiable risk factors, and the smoking. So these are the factors that can be changed. On the other hand, if you say the modifiable risk factors, sabi ko nga sa inyo, hypertension. So deviation in vital signs, diabetes, deviation in blood sugar, chronic disease, if yung pre-existing illnesses na yan. So na specifically hindi na siya matreat. Although sabi nga natin yung previous history can be considered as non-modifiable, pero yung chronic kidney disease kasi if na-sustain niya yung treatment, then it could sustain yung function ng kidney. But if not, ayun. So meron tayong control. Obesity, we have a control on the body mass index, level of cholesterol, even modifiable risk factors ang preeclampsia kasi ang preeclampsia usually happens during pregnancy lang. Kaya that's why modifiable ito, but can be controlled. Okay? Kasi meron namang hypertension kasi during pregnancy na walang proteinuria. So gestational hypertension lang siya. Kung may history siya ng preeclampsia, papasok siya sa modifiable. Tapos kung existing na ngayon na meron siyang hypertension plus proteinuria, pasok siya sa modifiable risk factors. So it could be both ways. Yung history ng preeclampsia, it could be non-modifiable. Tapos pagpasok ngayon na may existing siyang preeclampsia, modifiable risk factors na siya. Okay? Next po. For the non-modifiable risk factors, these are the behaviors naman and exposures that obviously cannot be changed. As what I've told you, tulad sa ethnicity, Asian, you cannot get away from that because we are Asians, and most of us have the similar metabolic response. Although it may vary only on the other modifiable factors. So we have the age, family history, and the gender. To have more, to have a deeper understanding on this, tulad nito age, sabi ko nga sa inyo, as it increases the age, you could be high risk of a certain disease. Sa gender naman, as what I've told you, at the age of 60, men are greater risk of cardiovascular disease than premenopausal women. Premenopausal meaning, kung for example, before 60 years old. So, in the situation wherein consideration po for family history, so yung immediate relatives po, traced by paternal and maternal is non-modifiable risk factors. At ethnicity, this is the one that I'm referring to. Ethnicity with Africans and Asian ancestry. Tapos yung may mga indigenous populations pa are high risk of cardiovascular disorders. So pwede po natin ito as long as this is based from the perspective of evidence base. So next po, we have the predisposing factors. Ito, pag sinabi natin na I know that you have encountered this, you are predisposed to this. Ibig sabihin, it considers yung tendencies. Okay, tendencies. There are tendencies that you may experience this. So that's why the mindset of a nurse is preventive. So that's why as nurses, we need to, that's why that's why we have a uniform a unified interventions pag mga newborn. Kasi alam natin why do we need to immunize to have immunization ng newborn. Why do we wrap the newborn and place it in a drop light? Why there's a need to have breast milk rather than other milk formulas? So this could answer po na based from the scientific explanation. O just like for example sa a newborn, most of the newborns po ay high risk for infection because their antibodies and immunoglobulins are not mature pa. So that's why newborns are already subject na for vaccination or immunization rather. Ano yung immunization that is subject for newborn agad? Because kasi high risk sila for TB or tubercle bacilli. Class, what is the immunization subject agad for newborn? Am I still here? Class? Students, what is again the vaccine or the immunization subject for newborns po? I'm not hearing anything. Am I still online? So, will you agree with me if it's BCG? Thumbs up nga kung BCG.
Yes po, Dean.
Yun, thank you so much. Kasi nga, since the immune system of the immune system, kaya if you will notice, through the weeks and months, may mga immunization na po na dapat ma-meet yung newborn. Kasi nga, as mentioned po, ang kanyang immune system ay still immature at ang antibodies and immunoglobulins are not yet fully mature. So kailangan ng antibodies. So next po, usually po if you will identify why is it that newborns may need exposure to sunlight? Why? Why newborns may need to be exposed to sunlight? What is lacking? What is lacking with the newborn? Okay. Come again?
Vitamin D po.
Correct. Vitamin D. At alam niyo po ba, ang vitamin D ay essential for the secretions of liver enzymes. Kaya, if ever po na you will not subject the newborn to to sunlight, yung natural source, sometimes pag nag-yellowish discoloration ang newborn, you may suspect that there's a problem with bilirubin. Kaya usually ang mga newborn po pag nag-yellowish discoloration sila, they will be exposed to Billy light. The Billy light is a specialized light to facilitate po yung control or to facilitate po yung regulation ng bilirubin. So, ang vitamin D po ang essential kasi para ma-regulate yung bilirubin. So, yung bilirubin kasi po, pag if it is high in the blood, that's the one that gives the jaundice color sa skin. So, that's why exposure to sunlight is essential because of the vitamin D. Pero since nga vitamin D is lacking, liver enzymes are not yet sufficient, ayun, pwedeng nagko-cause siya ng possible discoloration sa newborn. Next po, fewer nutritional reserves. Ang newborn po, as much as possible, they are given with breast milk compared to milk formula because the breast milk could support the needs of the baby. So in these situations po, dahil fewer ng nutritional reserves nila, they are high risk for dehydration, they are high risk for nutritional deficiencies. Kaya nga there are some instances that newborns are given with multivitamins aside from breast milk. Pero somehow, kung breast milk naman ang binibigay, that could support na to for the functioning or nutritional allowances needed by the newborn. Next po, what is expected po na you will observe when the baby was delivered sa extrauterine? Kasi remember, ang fetus po or ang fetus po sa intrauterine life ay ano na yan, nakahang or nakasuspend sa amniotic fluid. What is the one that covers the baby to protect from or to regulate temperature sa intrauterine? Ano yung naka-cover sa baby para makontrol po yung temperature or ma-regulate rather ang temperature? Ito yung ano, 'di ba? Yung
Vernix
parang yon na tumbok natin, yung Vernix caseosa. Tapos if you will notice also, yung hair growth, the hair growth are more are more prominent sa intrauterine kasi that is also essential for temperature regulation. Ngayon, kasi po why Vernix caseosa and lanugo are important while inside the uterus kasi this will regulate nga yung temperature. Ngayon, in the extrauterine life, the newborn had been delivered, 'di ba i-remove na ibabat na yung baby, i-remove na yung Vernix caseosa and the excess lanugo. So, less ang body fat, mas prone ba ang magiging prone na ba ang baby natin sa problem with temperature regulation if we remove already the Vernix caseosa and the
Yes
excess
po.
lanugo?
Yes
Yes. So
po.
that's why if you will notice immediately they are being wrapped po or exposed to drop light so that to add on the regulation of the temperature kasi the less body fat cannot the less body fat is not sufficient to insulate against cold. Kaya mas prone talaga sila sa cold at because nga less body fat. Ang fats kasi din ay nagre-regulate yan ng additional heat sa body to control temperature. So aware na tayo na we have the measures that are unified as intervention sa newborn care kasi these are the predisposing factors. Okay? So pag hindi i-administer if we will not perform those care management sa baby, this could be the baby could be predisposed to infection, predisposed to liver problem, predisposed to nutritional deficiency, and predisposed to problem with temperature regulation. For elders, I remembered when the time that I asked why elders are more prone to infection. Ang general answer ninyo are most decrease in immune function. So these are your most response po. In that on that perspective, we go deeper, di ba? We go deeper why in this perspective bababa yung immune function. So we have already specified, di ba? In the increasing age, ang reserve ng nutrients, oxygenation needed by the cells ay naglo-lose. Hindi na sila nag-i-store ang cells natin active to store kasi yung hormones kasi important yan for metabolic activities. Ngayon, if the cells are deprived already from the response of the hormones, hindi nagre-reserve ang cells ng nutrients, nakaka-affect din yan sa cellular activity. So kung nakaka-affect yun sa cellular activity, if the person, the elder is exposed to an infectious agent, delay din ang response ng cells to compensate and to defend to have immune defense ng body. Kaya mas prone ang elders rather. Other than meron kasi tayong mga hormones din that will protect the person from any infection. Kaso nga for elders, cells are not actively responsive, nadidelay yung response. Kung nadidelay yung response, nadidelay din yung prevention of complications. Kaya they are most considered as vulnerable. That's why it is related to the number 2, decline in homeostatic mechanism. Yung decline in homeostatic mechanisms, we have already defined yung homeostasis. So on that note, yung tinatawag natin sa homeostatic mechanisms na ito, sila yung most na predisposed sa mga diseases kasi nga the physiologic process and functions are already not balanced as expected for the normal functioning of adults. So most of the elders are high risk are predisposed rather for depression. So predisposed, may tendency, yan, they may have a tendency. Kaya yan yung term na ginagamit, predisposed, contributed, or it may have a tendency to have depression. Why? Kasi go back to the cellular activity. Dahil delay ang response ng cells, it may not control neurotransmitters. Yung, di ba most ng ating pong mga elders irritable, most of the elders natin may have problems with memory, most of the elders natin sometimes they have behavioral problems. So in this situation po, dahil hindi na controlled yung supposedly pag tumataas si dopamine, the serotonin will also compensate. Pero hindi na because of the delay cellular response, yung mas nagiging prone sila doon sa situation of sadness, doon sa situation of depression kasi nga hindi na nababalance yung coping pagdating sa response ng neurotransmitters. For the isolation, most ang mga elders natin ay nagsa-self-isolate because they interpreted that they are not anymore contributing to the household chores, they are not anymore contributing to the income of the family. They are useless. In short, they feel they are useless. So that's why they do have isolation. This is not the isolation that we are referring to quarantine. They are prone to malnutrition kasi tulad sa newborn, 'di ba, less fat to have the insulation. Ang malnutrition naman, less ang cell reserve. Kung less ang cell reserve, less din ang pag-meet sa nutritional requirements, sa daily nutritional requirement. So that's why they are prone for malnutrition or nutritional deficiencies. Okay, let us now proceed to gender. If we cover naman sa gender, ang problema naman natin dito, are based from ang male. Yan, ay male ay more or rather more prone to the following. Ang male po ay more prone sa gout. Ang gout po ay arthritis. At sa gouty arthritis, ang problem natin ay uric acid. So compared to female, ang hindi po makokontrol ang uric acid ay most sa male. Ang problem po natin pag ang level ng uric acid ay tumaas sa blood, what will happen is that once it will circulate yan, mag-circulate yon, yung excess uric acid, pag nag-shift yan from intravascular to interstitial space, usually, itong uric acid na to nagiging crystals. And these crystals po will proceed to the what? To the edges ng joints. At imagine niyo ang joints, di ba nakakonect yan sa bone? So every mobility nagkakos ng friction. So kung may crystals doon, nagkakos ng irritation ng joints. So arthritis ang tawag doon. So more prone po ang male. I have mentioned this also that men age 60 to 65 years old are more or 39% to have chances of heart disease compared to 27% of women of the same age group. Another is Parkinson's disease. Parkinson's disease mas most considered pong prone 50% ng men rather than women. Ano po bang Parkinson's disease? Ang Parkinson's disease po usually ay ito po yung mga uncontrolled involuntary movement due to affecting substantia nigra. Yung substantia nigra po, hindi linya nigra yung substantia nigra ay part of the brain na nag-control sa balance. Ngayon, pag yun pong part of yung substantia nigra ay part of the brain na na-damage, hindi na po yan magbabalance when it comes to the mobility and to yung posture. So that's why ang patient more may have rigidity, spasm, tapos uncontrolled at yung tinatawag nating tremors. Yan, mas prone po ang Parkinson's disease sa male. Other than that, male are more prone po sa autism. Ayan. So, these are mga behavioral problem. Usually ang autism natin problem with the di ba? Behavioral, emotional. So mas prone po ang men. Kidney stones, more prone po ang male, at inflammation of pancreas, mas prone predisposed po ang men. Let us now proceed with women. For women po, 80% sa Americans to which have similar data compared to the Filipino women. For Filipino women, high risk po by 80% or more osteoporosis for female. So ano po yung osteoporosis? Yung osteoporosis po is since ang elders po natin may not store calcium in the bone, so it makes the bone fragile. So nagche-change ng posture or stature ng individual. So most prone sa osteoporosis. Ibang osteomalacia. Ang osteomalacia naman po pag mayroong problem with vitamin D deficiency, na supposedly vitamin D deficiency is important for the storage of calcium, yun naman po nagkakos ng osteomalacia softening of the bone. Ang osteoporosis naman po is because of the calcium, nagiging brittle na siya. So, females also are more prone when it comes to stroke. Ang stroke po ay cerebrovascular accident. So, based from the results. Pero this may vary. Kung ang client natin, ang patient natin ay Filipino, we must take into consideration na predisposed if we use gender kasi non-modifiable dun sa pinaka-recent at latest findings. At kung ang profile natin ay Filipino, much better ang kunin ninyo Filipino. Ito kasi I presented Americans eh. So when you do pathophysiology at makakadinig ako na why you have considered male, gender, as a non-modifiable risk factors. O sasagot nyo na. According to the results of Filipino research in 2021, that females are high risk of the osteoporosis based from the findings of most of the Filipino women who are 70 to 80%. That could support evidence-based. Next po, sa women naman, mas high risk po ang women for migraine. Ayan. Next po, ang female po ay high risk for urinary tract issues or infection kasi shorter ang urethral canal compared to males. Multiple sclerosis. Ang multiple sclerosis naman po, usually this is a nervous system problem. And pag multiple sclerosis po, usually there's inflammation of the nerve. Pag may inflammation of the nerve, nagko-cause yan ng delay response kasi impulse transmission eh. So pwedeng may problem sa movement, may problem sa muscle contraction. So significant yan when it comes to mobility. So sa Parkinson's disease, more prone ang male. Ang Alzheimer, ang multiple sclerosis po, more prone ang female. How about Alzheimer's? Sa Alzheimer's naman, this is referring to situations naman na related sa memory, yung loss of memory, thinking, process, more prone po ang women sa Alzheimer's disease. So, sa genetic makeup, ang genetic makeup, this is usually for familial tendencies and I have mentioned naman po na predisposing factors for genetic makeup. Stress is considered also as predisposing factors kasi ang problema natin sa stress, maraming there are various effect sa body natin ng stress eh. Pwedeng ang stress ma-associate sa problem with circulation, problem with the kidney, problem with the brain, major. Kaya predisposed. Kaya pag if you are on the high level of stress, marami kang pwedeng masagot that you are predisposed with. Most po, pag ang stress, kino-consider po natin na dinidecrease niya ang immune system. It's because of the perspective na at the time of stress, ang body natin mas nagpo-produce ng substance cortisol. At yung cortisol po, pag sumobra yan, ang effect niyan ay nilo-lower ang immune system. So, yun po. Kaya you really need to cope with stress. Tulad nito, for example, kaya po that's why I have mentioned that stress has neurohormonal response. For example, ang person may have experienced stress. Ang adrenal medulla po, usually ang stress is sympathetic response. Ang adrenal medulla, napoproduce po yan ng catecholamines. At ang catecholamines naman po ay composed of epinephrine and norepinephrine. So yan yung parang sa sympathetic fight or flight. On the other hand, ang adrenal cortex naman is producing cortisol. Okay? So yung cortisol po na ito, ang problem natin dito is that of yung cortisol itself as a response of the brain to stress, pinapa-lower niya or nilo-lower niya ang immune system. That's why person could be high risk of the infection. Next, lifestyle predisposed. So, pag lifestyle, we have mentioned for kanina. So, we have mentioned diet, we have mentioned stress, we have mentioned smoking. So, even with the alcohol drinking, these are considered as a problem with lifestyle. However, tulad ng weight control, na-associate natin yan with the modifiable risk factors. Sexual practice, lifestyle yan, pwede siyang maging modifiable risk factors. Sa occupation po, as predisposed po, most ang mga individuals are exposed to noise, pollutions, at saka yung mga stressful events din related sa work environment. Ano naman po yung pre-existing illnesses? If we say pre-existing illnesses, ang pre-existing illnesses po ay sinasabi natin yan comorbidity. Kaya you've heard that during the time of pandemic eh. Kaya pag sinabi natin comorbidity, do you have pre-existing illnesses? Yung pre-existing illnesses that we're talking about is related to chronic illnesses. So ano yung mga chronic illnesses natin? Yung sinabi natin, diabetes, hypertension, patients who are already diagnosed with kidney failure, patient who may have already immunocompromised health conditions of cancer. Yan, mga pre-existing illnesses na yan na directly related doon sa high risk sila for complications. So we use those terms pre-existing. Sa environmental exposure naman, example, yung principle of the pag-prolong exposure to cold, anong effect sa body? It may cause vasoconstriction. Pagka extreme exposure to heat, ang problem naman dilation. Kaya pag dilation ang problem, increase ang metabolic response of the body. That leads to the sweating or perspiration. Sa cold naman, dahil ang problem natin constriction, ang nadidelay yung circulation at ang blood natin ay source din of temperature regulation. So nade-deprive. So that's why yung body response naman natin predisposed sila sa cold. So exposure to allergens naman predisposed sa mga pollutants or allergens, lalo na for those who are diagnosed with asthma. Long-term exposure to sunlight, environmental ito because of the UV light that is not uh, that may cause a problem with the integumentary system. At long-term exposure to occupational chemicals, environmental kasi pwedeng respiratory yung problem. So these are environmental. Predisposed sila to respiratory problem, integumentary, respiratory, and the circulatory system. Now, sa mental deviations naman, class, ito yung may mga psychiatric problem. Although in your third year, you may go deeper on these concepts. Pero sa risk factors din kasi, sometimes sasabihin, and you may heard this, na ang mental deviation pwede siyang namamana. Ang mental deviation pwedeng nag-lead from the experience. Ang mental deviation pwedeng from the background of the family. Ang mental deviations are based from trauma. So these are the risk factors. Pero the risk factors po kasi ng mental deviations ay according to three: biological, psychological, social, that's factors. Pag biological po, this is usually affecting the physiologic process. Yung psychological factors po ay are risk factors affecting relationship, at ang social factors naman po ay situations that affecting the environment. Yan, yung environment at saka yung socio-economic status. Example, sa biological factors, genetic cause. So if the familial history of merong may mga mental deviations, this could be acquired or this could be inherited. Excuse me. Biochemical alterations. Yung sinasabi kong biochemical alterations dito, yung neurotransmitters, yung sabi ko kasi sa inyo kanina, dopamine, serotonin, that may have imbalance in the regulation, kaya mas prone sa anxiety or depression. Next po, biological factors, infection. Kasi since ang behavior is more on the brain control yan, pag nag-cause na yan ng infection, intoxication, direct brain damage, pwede maka-affect yan sa mental state ng individual. Kasi alam natin na ang control ng thinking, control ng memory, control of movement, control of major functions, physiologic functions of the body are centralized obviously in the nervous system and specifically in the brain. So that's why pag blood vessels ang problem sa brain, it may deprive oxygenation. So there could be a dysfunction in the cerebral function. So perinatal causes. Pag perinatal causes naman, biological kasi pag sinabi natin pwedeng congenital or during the maternal state of pregnancy, naka-affect dun sa fetus, biological po yon as risk factors. For psychological naman, if you will notice, it's more on the relationship. Kung merong maternal separation, relationship with parent-child, marriage problem, stress, season. Bakit yung season na consider? Ito usually one of the examples dito yung Norway. Sa Norway, very short ang very short ang daytime nila compared to nighttime. Kaya sa kanila sa Norway po at 3 o'clock PM madilim na. Kasi yun na nag-i-start yung kanilang night yung night time na nila eh. Kaya alam niyo syempre kung nighttime tayo we set our mind to be in our own homes. So mas shorter yung time talaga to have social interactions. Yon, sexual difficulties could be psychological because eventually this may affect. Kaya if you will notice pag sa psychological factors, if we will try to realize yung Maslow hierarchy of needs, pag sa love and belongingness, self-esteem, self-actualization, pag yan na ang deprive, pumapasok na siya as psychological factors that may lead to mental deviations. Sa social factors naman, bakit sinisi naman natin sa kahirapan? Sa poverty, usually we considered it because of the situations na hindi napaprioritize yung health. And the state of health po when it comes to nutritional food, yung basic needs hindi nami-meet. So it may lead to the imbalance then ng affecting biological factors. Unemployment may have also contributing to the needs. Urbanization, if the person cannot adjust to the environment itself, cannot adapt. Alcoholism, ba't nasa social factors ang alcoholism? Kasi kung for example, if you wish if you are already engaged into an environment na every day, at all times po, you can see individuals are drinking alcohol. So, it may give a major influence at all. So, other than that, other than yung social, yung social effect na yon, yung effect naman ng alcohol sa biologic factors. Broken homes, religions and traditions also, there are some situations that inhibit a person to lead to a specific communication. So may mga traditions and practices. So now I have mentioned po sa atin sa etiologic factors or sa risk factors natin yung predisposing contributing to the mental deviations. Age predisposed po sa mental deviations. Genetic factors, it could be inherited. Intrauterine, 'di ba, if it is sometimes congenital. Chronic disease predisposed sa mental deviation simply because kung ito ay from the time of birth, so chronic disease na, pwedeng ma-experience na for life na. Early life adversity, if the person was deprived from the needs niya. Kaya familiar kayo in the stages of development, you have been oriented na you really need to meet the needs per stage. Pero pag nade-deprive po, may something lacking that you cannot cope, that may reflect on the next stage of your life. So yun yung tinatawag nating early life adversity. Next po, pag sinabi naman nating precipitating, so contributed yung predisposing, yung precipitating factors naman trigger. This is the ones that triggers yung mental deviation. Trauma, yan, so biological, psychological, yung mga conflicts, frustration, bereavement. Kasi if you have remembered dun sa, I don't know if it's fundamentals of nursing or sa theoretical foundations, yung stages of grief, yung DABDA, denial, anger, bargaining, depression, acceptance. There are some instances na we may not pass through these 5 stages, yung DABDA, pag-bereavement. But there are some instances na yung iba dumadaan talaga sa DABDA, pero yung iba kasi denial, anger, pero mabilis yung acceptance. Pero yung eto nga, pwedeng mag-trigger kasi yon pag ang person has low support system. Doon sila most probably tumatagal yung kanilang mental mindset for recovery. Another trigger is epidemic health concerns kasi pwede siya maging precipitating. Kanina sinabi natin predisposing, ngayon precipitating, that the one that triggers kasi nagti-trigger po 'yan kasi yun nga, new protocols will be considered. So pwedeng ma-deprive ka from mental, pwedeng high risk ka for infection. So yun, yung certain adjustment by which a person cannot adjust or may be high risk. Pwedeng nagti-trigger yon in the system. Sleep deprivation pwede mag-trigger kasi we really need to consider po yung enough sleep so as to meet the physiologic need. Yung infection and physical restraints po can also contribute as trigger sa mental deviation. Kasi sabi natin sa sepsis, biological factors. Last but not the least, for the mental deviations, perpetuating factors. Yung perpetuating factors naman, ito yung factors that may lead to mental deviations na based from practices and beliefs na sometimes ito yung naka-mindset sa iyo kasi you are already practicing it and you are not embracing trends and changes. So some of them may have their own beliefs and they do not trust medical experts. Kaya ano tong mga situations na to? Harmful illness beliefs. Yung mga situations na you will manage it on your level to use medicinal plants na hindi naman approved by the DOH. You consultate healers, albularyo. So nagkukos pa ng complications. Negative health habits kasi for example, example, yung situation na perpetuating factors, if you have menstruation, ang sabi ng lola ko, hindi daw dapat maligo. So kung yun ay na alam mo, the hygiene, self-care deficit. Misinformation kasi sometimes yung access sa information na walang scientific basis, yan, perpetuating factors yan, naniniwala sila sa mga fake news. Social support factors, mas naniniwala po sa peers rather than sa scientific basis of conditions. At chronic illnesses. Yung chronic illnesses natin, kinoconsider siya as perpetuating factors kasi sometimes yung person, mas kinoconsider niya na yung experiences niya at yung experiences niya yon mas naniniwala siya na mas makakapagpagaling sa kanya yon rather than to listen to medical experts. So these are the risk factors, and I ended up my discussion. So supposedly we will end up to 7:30. So we ended up to 7 o'clock. So I may start to open the self-assessment exercise in week 1. You can start answering na. For now, I will start to open up the exams, and that could be also open until Thursday. So ang quiz po natin sa Thursday is all about the periods of disease and the chain of infection. So thank you very much, and thank you for listening, everyone. God bless.
Thank you po.
Thank you po, Dean.
Salamat po. Thank you so
Thank
much.
you po, Dean.
Thank you po,
Thank
Dean.
you.
Bye po.
Thank you po, Dean. Bye-bye po.